Hi, my name is Ruth Hopte, and today I'll be presenting about CTE and its relation to REM sleep behavior disorder. So, what is CTE? CTE is defined as chronic traumatic encephalopathy. It is a progressive neurodegenerative brain disease which is caused by repetitive head trauma. Most people diagnosed with CTE have suffered hundreds or thousands of head impacts over the course of many years, either playing contact sports or serving in the military. Um, that is why CTE is most frequently found in contact sport athletes and military veterans because they are the ones that are most vulnerable to that. How is CTE diagnosed? Currently, CTE can only be diagnosed after death, and that is because of the fact that a brain tissue analysis needs to be done. And you can't even make the diagnosis without a neuropathological examination of the brain tissue, and that is the only way to find out. What is basically being looked for is the deposition of an abnormal tau protein that clusters around blood vessels in the brain, and that's a very distinct lesion we can see over here. This is the abnormal tau protein accumulation in the brain of someone with CTE, whereas this is the brain of a normal person. All right, symptoms of CTE. Symptoms of CTE can vary, but generally affect cognition, mood, and or behavior. It is oftentimes a personality change, behavioral or mood change like depression, aggression, violent behavior, impulsivity, and short fuse. Some report mood and behavior symptoms as early as their 20s, whereas like most of the cognitive symptoms tend to appear later in life, mostly in patients who are in their 40s or 50s. In some cases, it worsens with time. In other cases, symptoms may be stable for many years before worsening. All right, so the neuropathology associated with REM sleep behavior disorder. Basically, we know that there are sleep regulation centers present in the pons and midbrains, and in people who suffer from RBD, they often have Lewy bodies that are present in these regions or in these nuclei. This technically leads to the loss of connection of cells or maybe even the death of cells. And that is how sleep disorder is manifested. So I was just trying to give an overview of just a refresher of like REM sleep behavior disorder that we've covered in class and more or less tie the biology aspect of it, or the neuroscience aspect of it. And we can see here, these are the pons. It's just to refresh your memory. All right, so REM sleep behavior disorder and CTE. So what is the relation? So basically, a team of researchers from the Virginia-Boston healthcare system and the Boston University of School of Medicine analyzed brains of 247 athletes who donated to a brain bank, the VABU-CLF Brain Bank, to explore the relationship between contact sport participation and REM sleep behavior disorder. And what is so fascinating is that they found that even though, like, while an estimated 1% of the general population suffers from REM sleep behavior disorder, these researchers found that 32% of the contact sport athletes with CTE experience sleep symptoms characteristics of REM sleep behavior disorder. That was very similar. They further examined the brain of those with CTE and RBD and also found an unexpected association between the pathology and sleep dysfunction. So basically, most patients with the RBD, like with RBD or with REM sleep behavior disorder, they have Lewy body pathology and are associated with Parkinson's disease, which is another neurodegenerative disorder. However, most of the CTE patients or the CTE participants with RBD symptoms, they do not have this Lewy pathology. Instead, compared to CTE participants who did not have slim symptoms, they were 4 times more likely to have tau pathology, which ties back to what we talked about in the very beginning of this presentation. So this tau pathology within their brainstream nuclei, which is also involved in REM sleep. And that is basically the main finding of this research that I was trying to cover in this presentation and in this project. Thank you so much. If you have any questions, feel free to reach out and ask me. But yeah, thank you.